Hi, Dr. John Torres here with NBC News on this Facebook Live, answering your questions about coronavirus. But first I want to get to a couple of headlines you might have heard about and a little more explanation behind them. One, a Harvard study just came out saying we might actually have to social distance well into 2022. That's 2 years from now. And I think that's shocking. A lot of people thinking, oh my gosh, are we going to have to keep doing the same things we're doing right now for the next 2 years? No, this was a mathematical projection, a model. And like we've talked about modeling in the past, it's basically a very educated guess as to what might happen in the future. And what they're saying is if we don't change anything, then it looks like we possibly have to social distance for the next couple of years. There's a couple reasons behind that. One, we know coronavirus is going to come back most likely in the fall, and it might never completely disappear this summer. Once we start interacting with each other, then there's going to be more people getting sick again. So that curve we keep talking about is going to decline. Once we start going outside, it's going to go back up again. The idea here is to make sure that people understand that once that starts going back up, we all need to do the things we need to do to stay safe, not just in our communities, but in our regions and maybe even nationwide. And that means the social distancing kind of stuff. If we don't do that, then what they're saying is we might have the next couple of years of having to do that because we weren't able to keep it under control. So essentially they're saying, you know, it's sort of a worst case type scenario. If we keep going the way we're going until 2022, we might have to keep doing these types of things. If on the other hand, a couple of things happen. One, we start getting medicines, we start getting vaccines that can help out, we might be able to do that sooner rather than later. And two, if we all listen to what we need to do and do those things, especially in those hotspot areas that are going to crop up once we start interacting with each other, then we should be able to get out from social distancing sooner rather than later. But remember, it's going to be very intermittent, and we're probably going to have time periods, depending on where we live, of having the social distance for a week or two just to get it under control. And the hope is that the CDC actually has a lot of contact tracing. They have essentially an army of people, or they should have an army of people to go out there and find out who somebody sick got in contact with, get those people quarantined to get them out of society so other people don't get sick, and we keep it under control. That's how we're going to keep these hot spots from flaring up even more and causing more of an issue, especially across the whole nation. So that's the one headline about possibly having the social distance to 2022. But remember, it's a mathematical model, it's a prediction, and so we can do those things we know work to keep that prediction tighter, meaning that we get out from social distancing much, much sooner, and that's the goal here. Number two, Dr. Fauci today went on air and he said that he thinks sports is going to come back, but it's going to come back initially with just the players, no fans, no audiences. And the reason he thinks that's going to happen is because it's going to be a much more controlled environment. What we're thinking is that when the players come back, they're going to be easier to test. And that means having the antibody testing on top of the testing we do now, which is looking for people who are actively sick. The antibody testing can tell us who might be immune to it. And if they are, then they can certainly get together and play. On top of that, they're going to constantly be testing not just the players, but the coaches and their families to make sure it's not spreading. And if it does, to isolate that team or those players. The reason they're saying let's have the players first is because it's a very incremental, stepwise fashion of getting sports back into our life. Players first, so empty stadiums, empty arenas, those types of things, and we can watch it on TV, which is not as good as being there live, and even the athletes will tell you a live audience is so much better, but it's better than what we have right now. And then once we start getting this under control, again, we're talking about making sure we do that social distancing to quell down the hot spots, then we can start opening up to fans. And my guess is when we open up to fans, it's going to be maybe 25% of the fans in the stadium. So they can practice that social distancing. They might have to wear masks during the event to watch it. And then gradually work your way up to 50% of the stands occupied, then 75%, and then eventually get back to full occupation of the stands and the arenas like we've had in the past, but doing that over the next year or so. I'm thinking this summer you're going to see more of the players by themselves and then stands partially full, and then eventually work our way to stands completely full. The main object behind that, again, is to keep an eye on what's going on this summer because this is a new virus. It's very unpredictable. We're not exactly sure what's going to happen when crowds start congregating again, and just to make sure that they're not congregating at that level of 50, 60, 80,000 people all in one arena who could be spreading it around. Keeping the numbers under control so we can keep the virus under control. So those are things that are very important. Now, one of the things I do want to do is make sure I answer viewers' questions. So please, if you have any questions, send them to us, and I'll go ahead and answer as many of those as I can. But let me see if we have any questions right now.
You know, a number of people are asking, we don't know much about coronavirus. How do we know it's coming back?
So the question is, and this is a wonderful question, we don't know much about coronavirus. How do we know it's coming back? Well, if you remember a couple of months ago, it was called novel coronavirus. Now it's called SARS-CoV-2, which is severe acute respiratory syndrome coronavirus 2 because of the SARS outbreak we had in 2002. This is the second one, a different type of virus. It's coronavirus, but a different strain. Well, the reason we think it's coming back is because that's how coronaviruses, that's what they do in the environment normally. This one is new, so we're not exactly sure, but we do know that coronaviruses in general tend to be seasonal, and they're typically what cause colds in us. And so oftentimes we've probably had coronavirus, not even known it, but this one unfortunately is more severe and is causing all these deaths. So we think it's going to behave like other coronaviruses, and it's going to come back, and in fact it might never completely go away this summer. It might just have an undercurrent of very limited number of cases until it pops up again. Coronaviruses are more cold weather viruses. They tend to be more active in the cold weather, and also we tend to congregate more in cold weather. Plus we have runny noses and we're coughing and sneezing a lot more, which means that we can spread the virus easier. So that's why it's more of a cold weather virus, but we don't think it's going to completely go away in the summer. However, again, this is a new virus. It could go in many, many directions. It could stay year-round, it could turn seasonal like most people think, or it could even mutate to the point where it doesn't affect us anymore. We can't rest our laurels on it mutating to where it can't affect us, which is why they're putting so much effort into getting the vaccines, getting the medicines that can help, and doing that social distancing. But that's a fantastic question.
Are all plastic gloves safe? What about the food handling gloves versus the nitrile gloves? I'm worried I'm wearing the wrong thing.
So the question is, are all gloves safe? The type of gloves people are wearing. There's a couple of different kind of gloves. There's the plastic gloves that as long as they're intact, they should be safe. Then there's the latex gloves, which were originally what we used in hospitals and clinics, but a lot of people developed or had latex allergies, so we switched to what are called nitrile gloves. Nitrile gloves are usually those blue or black gloves that you see people wearing, and they tend to be a little clingier and a little more comfortable material, and they don't have latex in them, so it's not quite the issue with allergies. As far as if they're safe if they're intact, but for the average person going out and about, it's not recommended you wear them. The recommendations are to wear a mask if you're out and about, and we're talking about just a regular cloth mask that you wear, but not to wear gloves. Here's the reason behind that. Because our skin, if it's intact, there's no way the coronavirus is going to get through our skin. And even if we have cuts, it's not a blood-borne virus. So if it gets into your blood, it's not going to get through your body that way. It's a respiratory virus. It gets into your nose, gets into your throat, and gets into your lungs, and that's how it gets throughout our body. So the gloves themselves don't give you any better protection than your own skin. The problem is when people take gloves off, they don't necessarily know how to take them off correctly, and so they end up contaminating their hands and not being able to wash their hands. Or they ended up having gloves that are broken or have some kind of cuts in them, so it gets through there. Plus it gives them a false sense of security, so they handle things they wouldn't necessarily handle. They don't necessarily wash their hands before they touch their face, and that's how they can get coronavirus. So the current recommendation again is not to wear them in the general public when you're out and about, because they're not going to give you that much protection, if any at all, and they might give you that false sense of security and actually make things a little bit worse.
What's so important about antibody testing?
So the question is, what's so important about antibody testing? Let me explain a couple of different tests we have going on here. The tests we've had so far over the last couple months that you've heard a lot of news about not having enough of those. Those are the RNA tests, we call them, which is the material that the virus is made out of. Those tests detect whether somebody is actively sick, if they have an infection right now. And so what they'll do is they'll take a swab and they'll put it in their nose or their throat, and they'll get some of that virus off of that. They'll use it, they'll amplify it, they'll multiply that virus in the lab or in the testing device, and then they'll determine whether it's in there and give them yes, you have it, or no, you don't have it, which means that you have that infection. Now, once you recover from the infection, your body develops antibodies. Those antibodies, there's a couple of different kinds. There's IgM and IgG. And forgive me, this is going to get a little scientific, but IgM are the initial ones that come over the first couple weeks after you recover from an illness. And they're the kind of the quick acting antibodies that fight it off from happening again and keep it from reactivating in your body. IgG comes along later, over about a 4-week period, and those are the ones that stick around for the rest of your life, or at least part of your life, and those are the ones that fight it off long term. Now what we're looking for is those IgG ones to make sure that you have some immunity built up to it, and that's what the antibody testing will do. It'll determine if at some point you were sick from this, you recovered from it, and now you have an immunity built up to it. A couple of caveats here. Remember, 25 to 50% of people who have coronavirus don't show symptoms or are pre-symptomatic. They only had light symptoms or mild to moderate symptoms, so they might not even know they have it. So there's a lot of people out there who might be not even be getting that test to find out if they're sick, but have an immunity because they had it at some point. The idea is use this antibody test to find out who might have an immunity built up to it, so then they can get back out into society and they're not necessarily at risk of developing it a second time. The other caveat, though, is we don't know how long those IgG antibodies are going to last. We don't know how long they'll have an immunity. The current thinking is they'll have it for about a year, maybe a little bit longer, but we're not sure because this is such a new virus out there. Typically, it lasts a little bit longer than a year, but that vaccine hopefully comes out within a year to 18 months, and so it covers that time period after that in case we need that. But that's why that antibody test is so important, and that's the difference between the antibody test and the active infection test we're talking about, the RNA test that they've been using for months now. Now, right now, there are one FDA-approved antibody test out there and other tests that are out there that are coming out that hopefully will be approved soon to test that antibody, but the numbers aren't that great yet. Hopefully, according to the Coronavirus Task Force, we'll have those within weeks, and we can really ramp that up so we can find out who's immune, because that's going to help, like I talked about, the athletes get back to playing, people getting back to work, especially essential workers and frontline workers, and getting people out and about, getting them out from their apartments. That's the goal behind all this.
Are there any information or progress on the vaccine, and are there any medicines that we can treat this?
So the question is twofold. One, are there any medicines that can treat this, and what's the progress on the vaccine? I'll start with the medicine first. You've probably heard a lot about a couple medicines. One's called chloroquine or hydroxychloroquine. That's a malaria medicine. The chloroquine has been around since the 1930s, 1940s, treating malaria, and it has a great record of treating malaria. Hydroxychloroquine came along because chloroquine does have a side effect where it can cause a heart arrhythmia, heart palpitations. They developed hydroxychloroquine to try and get away from it, and they're partially successful. It's better, but it's not completely resolved from causing those arrhythmias. Both of those seem to be able to treat coronavirus, at least we think it does, but studies are kind of back and forth. Some studies are saying it didn't work very well. Other studies are saying it looks like it might show a little bit of benefit in treating coronavirus. The concern is that people will take those on their own and have issues, especially with those cardiac arrhythmias. There's no recommendation to do that at this point. Those medicines are still under research, and hopefully we'll know within the next few months. The other one is called remdesivir. It's a medicine that was initially developed for Ebola. It seemed to work pretty well for that, so now they're trying to see what it does with coronavirus. Again, some studies are showing promising results, but the jury's still out. We need to get those good studies done over the next few months to determine whether it really is going to help us or not. And we don't want anybody to take any of these things on their own because, again, sometimes these medicines can do harm than good. More harm than good. Now that's behind the medicines. The vaccine itself, of progress. Actually, yesterday or 2 days ago, I did a Facebook Live with Dr. Peter Hotez. He's out of Baylor College of Medicine. He's one of the vaccine experts in the world, and he was telling me that he thinks within 18 months we'll have this vaccine. Other experts have said 12 to 18 months. You have to realize, though, how quick that is in the vaccine world. That is extremely fast. Vaccines usually take 5 to 20 years to develop, more on the 15 to 20 year edge of things. He is telling me that the world's record for a vaccine so far is 4 years. That's for the Ebola vaccine. This would beat that in half, if not more. And so that's an amazingly fast time. But it's almost like the Manhattan Project for vaccines. There's so many people trying so hard to get a vaccine out there. Right now, estimation is there's 70 companies trying to work on it. What Dr. Hotez told me is that he thinks it's going to filter down to 4 or 5 companies that are making very good progress, and that a lot of effort will be put in behind those, and they'll be developing a vaccine. Now, vaccines go through 3 different trials. Phase 1, meaning a few people to determine its safety, and then what we call efficacy, if it seems to be working. Phase 2, more people to look at that even more. And then Phase 3, kind of the general population, even thousands of people to find out how well it's going to work, if it's safe in particular, and if it's good, if it's working effectively like we want it to. Those trials are dictated by biology. They can only go so fast. But what they're saying, and Dr. Fauci said this in a coronavirus task force meeting a few weeks back, is as opposed to most trials, we'll wait for it to go all the way through the 3rd phase, and then they start developing it and producing it. This one, they're going to see which one looks most promising at phase 2, and then start producing it being a gamble, saying it might not be all the way through phase 3, it might actually fail, but we think it's good enough we want to start production because we want to make sure that once it passes phase 3, it's good to go, because that's how much we need this. And so this is going to be a unique situation for this vaccine, hopefully within 18 months, even more hopefully so within 12 months, but time will tell.
We talked about sporting events, but how will we be opening up in steps? Or what would it look like? What about schools and colleges? Will our kids get to go back to school?
So the question is, we talked about sporting events and how that's going to open up in kind of steps, but how about society? How about schools and colleges and kids going back? It's anybody's guess as to what's going to happen, but what most people are saying, and I agree with them, is there's going to be a stepwise fashion. So now we have essential workers going back, especially frontline and healthcare workers. Once we get that antibody test and we can tell who has an immunity to it, then we can start letting more people back to work. A couple things need to be in place. Number one, our hospitals need to be okay at this point. They need to not be overwhelmed with patients in case that surge starts up again, because we know when people congregate, there's going to be more people getting sick. Hospitals need to be able to take care of them. Healthcare workers need to be able to take care of them and have the proper equipment. So we need to have the hospitals more under control. Number two, we need to have that testing we're talking about, both the testing of who might be sick at the time and the testing of who might have immunity to it. And then number three, a thing called contact tracing. And that's something the CDC is working on. And essentially what that means is, if somebody is sick, whoever was around them for a certain period of time would get tracked down and told to quarantine themselves for 14 days. And it depends on how far they take this and how serious they take this as to how much that means for us in general society. It could be all the way to the point where if a cashier at a grocery store had coronavirus, they could look at who went through that cash register, looking either at cell phone data or looking at credit card data to find out who went through that cash register, and then coming to them, knocking on their door and saying, "Excuse me, you were at a certain cash register yesterday. That cashier has coronavirus. Confirmed. We need you to quarantine yourself for 14 days." This might seem a little hard, but it's the kind of thing we need to do to keep this under control and keep it from cropping up again. Because once things start getting into an area, these viruses, it's really hard to get them out and they can start spreading. So it's important to do that. It's not going to go as far as some countries where they completely track them down with cell phone data, credit card data, surveillance cameras, all those type of things, because that's not the kind of thing we do here. But it's going to get partially to that level of where we're trying to track down who has these for the better good of the public health. And so there is that balance of privacy versus public health, and the experts are trying to walk that fine line, and hopefully they do a fantastic job of doing that.
Can you explain why this is worse than the flu, when the flu has killed so many every year?
So the question is, why is this worse than the flu, even though the flu has killed so many more over the years? Well, and back a few months ago, I was even talking about this, about how at that point, since coronavirus hadn't even really left China yet, that we need to be more concerned about the flu, because the flu was here and the flu was killing tens of thousands of people a year on the average, and it was infecting millions of people. This one is such a new virus that we need to keep it under control, because the flu, one of the issues behind the flu is, since it hits every year, even for those who don't get vaccinated, it's possible that they have a small amount of protection from that flu. Not a very big amount. The vaccine gives them much more, but a small amount of protection, because it's not a new virus to us. It's a new strain, but not a new virus. This is such a new virus that it's one of those things that our bodies don't know how to handle it, and so our bodies have a hard time dealing with it, and that's why people get sick and unfortunately die because of it. So to keep that under control, we have to instill these harsh measurements of social distancing, closing down businesses, and making sure people stay away from each other during this time period. As time goes on, we might get more resistant to this virus and be able to keep it under control. But for now, that's not something that's going to work as well as we'd like it to, because, again, it's such a new virus that we need to impose these steps in order to make sure that we're all keeping very, very safe. As far as the flu right now, to date, so far, the flu has killed around 24 million people. This virus has already killed around 30,000 people. And if you remember, 24,000 versus 30,000, if you remember, we put in so many harsh measurements here and so many strict measurements that 30,000 could be estimated up to 2.2 million. And so this virus, at least for the time being, since it's a new virus, is much more aggressive, much more deadly, and could even spread much further than other ones. And so it's one of those things, again, that you have to be very, very careful with. And it's hard to compare the two. It's almost an apples to oranges comparison. But the best thing you can do for yourself, especially come next season when we think coronavirus is going to come back, is protect yourself from the things you can protect yourself from. And that particularly means the flu. Get your flu shot early in the season so you're protected from it for a couple reasons. One, that way if you do get sick, more than likely it's not the flu. It probably could be coronavirus, so we can start, as a medical expert, start thinking about that. And number two, you're not getting yourself sick from the flu, suppressing your immune system, and giving the coronavirus an opportunity to move in. So you're giving yourself the best benefit of the doubt, the healthiest benefit you possibly can. And that means this summer, stay as healthy as you can. Fruits and vegetables, exercise. Please quit smoking if you're smoking, because we know that's one of the huge risk factors. Do the things we know that can keep you safe when it starts coming back in the fall. And hopefully it doesn't come back to a big extent and we keep it under control, but we just want to be careful and we want to be sure. So again, thank you for listening to this. I appreciate all your questions. They're fantastic questions. And everybody, please stay safe. Remember social distancing, hand washing, not touching your face, wearing masks when you go outside to protect other people and yourself. And just have the best day you possibly can. Thank you.